Hi everyone, thank you for joining us. If you weren't with us last Sunday, my name is Anika and I organized this with my mother. So this is the second of 3 sessions and is going to be conducted by Dr. K.M. Bopanna. He is the HOD and consultant for neurosurgery at Manipal Hospital and has over 20 years of experience. Today, he will talk to us about seizures, strokes, fainting and falls.
Morning, everybody. Thanks for having me on this, Anika, and thank you all for making time on a Sunday morning to be here. So, over the next half an hour or so, I will get into what first aid is about and why it's important. Since I'm going to be talking about the brain and emergencies that arise from it, to just give you some background of how the brain works and gives rise to these emergencies, we'll deal with the conditions that we're going to be learning how to administer first aid for, like stroke, seizure, falls, fainting, the do's and don'ts, and have conclusions, and we can have Q&A at the end of the presentation. So it's quite interesting if you go through the background of first aid. This organization, the International Federation of Red Cross and Red Crescent, actually has a lot of work going on at grassroots level to create increasing first aid awareness. The Indian Red Cross Society, which is one of the flagship societies for first aid, actually began at the time of the First World War, way back in 1920, where they were helping the World War I soldiers at the front line. And since the last 20 years, the second Saturday of September every year is celebrated as World First Aid Day. So that's the nice to know. And here's what's not so nice to know. Less than 2% of our countrymen are trained in any form of first aid, which includes even applying a simple bandage. And as per a study which was done about 3 years ago, based on road traffic accidents, it was found that many more lives could be saved if at least 30% of us in any given community were trained in some form of first aid. So what is first aid and why is it important? So first aid is defined as the emergency treatment that can be given to an ill or injured person before formal medical care arrives. And this symbol is the universal first aid symbol. Now, why is it important to know first aid? It's a big deal, honestly, to be able to administer first aid quickly, because when people are injured initially, the most important thing is to make sure that you are capable of limiting that level of damage at that point. So protection is a big deal. You don't want them to struggle when they're hurt, or if they're bleeding, to make a wound get contaminated. So protecting them is very important. So protecting, promoting healing and recovery are all linked. And relieving pain, of course, because anxiety can grossly interfere in clinical pathway, which we'll come to in a bit. And of course, who doesn't want a little comfort always when you're in pain? And at its extreme, saving a life. So what are some of the rules of first aid? Now, in my opinion, rule number 1 is to call for help. No matter how proficient you are, no matter what qualification, the first rule is to always call out, yell out to someone for help. The first rule, like I told you, is to yell for help, right? Now, this is important because you always need somebody to help, especially when it's a physical issue like shifting or being able to apply pressure on a wound to calm you. It's always better to work as a group, right? Now, prevent them from harming themselves by doing something that was probably not recommended under the circumstances. The number 1 factor that you need to check is whether they're breathing. And ensuring that this all happens in a hygienic surrounding, which means you don't want wounds to get more contaminated. You don't want them inhaling further contaminants if it's, say, something like a gas leak in the kitchen and things like that. And whenever there's any doubt as to complete recovery, please call an ambulance early. So it's interesting to note that first aid actually has very violent beginnings, paradoxically. So it was over 1,000 years ago, when Alexander the Great is thought to have saved a soldier's life who was choking by inserting the tip of his sword through the windpipe, which apparently, gross as it may sound, was highly documented as one of the earliest reports of a life-saving procedure we call as tracheostomy. Now, this saw various forms come and go till at the time of the European wars, when a German military surgeon called von Esmark actually pioneered what we see today as organized first aid. And the word has its origins from the UK, where for wartime people saw the need to call this as a first treatment and make it a national policy, which resulted in the word we see today called first aid. So this is an acronym you're going to see repeated throughout this presentation, and it's applicable for all circumstances of first aid. So you need to see that, guys, see ABC, right? So what does the C stand for? So the C is calm yourself, just like on the airlines where they tell you to make sure you've taken care of your own welfare before helping others or children. You need to make sure you're calm first. Always check around your surroundings, because the person you're going to help could have slipped on oil, fallen and had glass splinters all around. And the last thing you want to do is injure yourself before you try responding to anybody. The R stands for check the injured for response. You always need to know where they're injured, because they could probably guide you to giving them relevant first aid. It's no point giving them random ABC, and it's not uncommon that we've had unsuspecting younger doctors jump on chests of completely conscious patients. But anyway, that's another thing altogether. And here's something more common, the ABC, which I'm sure you've heard many times. So always check if they're choking, which is how you can help their breathing. If they're choking, you need to follow another pathway. Look for whether their air, you keep your hand close to their nose and the mouth, look for air blast, and assess if they're looking pale. So this is how you go about the initial assessment. So this is a small illustrated list of the essentials that you'd need for your first aid kit. So I think have something that you wouldn't find commonly in everybody's first aid kit would probably be gloves, and of course having adequate amount of painkillers, and of the antiseptic solution like betadine. Any regular antiseptic solution is fine. And in today's world, of course, the pulse oximeter and painkiller are must-haves. And so I'll kind of shift gears and give you some background of how this organ called the brain works. This is the most complex organ in the body, and if you were to look at its function in terms of the nerve cells, it consists of approximately 80 billion nerve cells or neurons, which are kind of in a stabilized state of function in a normal state of consciousness. Now, you could have situations, if I were to give an analogy of, say, an electronic device, you could have a situation where your power input is cut off, which is something similar to what happens in a stroke. Or you could have the other end of it, where you have like a voltage surge, which causes the equipment to malfunction. So both of these can cause malfunction. And how the brain works is you have two halves of it, and there are certain zones that kind of govern the movement of certain parts. So when it comes to movement, this small red strip that you see over here is what you call as the motor cortex. So this supplies the opposite side of your body. And if you see this thing here, so this is how the body is represented on the brain. So the outer side represents the tongue, the face, the hand. And as you come onto the inner side, you see the leg is represented. So this is in a nutshell how it works. of course, how it differs from just this mechanistic understanding is its role in consciousness and emotion, which is a whole different ball game. So with that background, I'll get into seizure. So seizure is basically excessive electrical discharge from a part or the whole brain, and due to which it could result in involuntary, chaotic, jerking movements. At its extreme, it could be with or without a complete loss of consciousness and frothing from the mouth. They could soil their clothes. So this is what you call as a generalized seizure. Now, at the other end of the spectrum, there could be something as small as blank stare or lip smack with random movements, which is very brief, which you call as a partial seizure, where they don't respond and they make these random movements like going on rubbing their thigh or trying to pinch their clothes. Trying to pinch their clothes. All of this could also be interpreted as a seizure. Now, I've had an instance actually where a 8th grade kid who was otherwise this model kid and doing fine academically was suddenly noticed in school to go around spitting. And unfortunately, this got necessary attention in the wrong way in terms of a lot of counseling and some not so favorable behavioral therapies, until when they actually came to a neurologist, and he found that this was a variant of complex partial seizure. This kid went on to anti-epilepsy medicines and was doing fine thereafter. So seizures is not only the variant that we all think where it's violent. So first aid in seizures involves protecting them from hurting themselves. Basically, insert whatever soft cloth you can get your hands on, a pillow, take out a shirt, blanket, anything that can prevent them from harming themselves further, right? Now, when a seizure, thankfully for us, all or majority of seizures actually are self-limited. They eventually go away, as frightening as they may be to observe, but they eventually go away. So all you have to do is make sure that they protect themselves. So you turn them to the side when you see that they're violently shaking, and turning them to the side helps in two ways. Number one, it prevents the tongue falling and blocking their airway. And the second way it helps is the secretions don't get swallowed. So with this, the next step would be to make sure they're breathing and time the seizure. Now, the importance of timing is that when they have a seizure that's going on uncontrolled for over 5 minutes, the likelihood of other complications cascading is pretty high. So you'd want to control their breathing and things like that, where, then, of course, specialized medical aid is very important. Now, it's not uncommon for somebody who's just walking to slump and injure himself with a seizure. So if that has happened, you need to be aware they haven't dislocated a shoulder or bitten their tongue badly, hit the head against an object in the course of their fall. So make sure you kind of look at them from head to toe to ensure there isn't any other injuries. Here's a list of misguided first aid treatments that somehow it seems impossible to dispel. Now, this putting a key in their hand is absolutely unnecessary and can even cause harm, especially on considering the state of contraction of the muscles is extremely high when they're having seizures. So don't ever try to put anything in their hands. Don't restrain them. Don't put anything in their mouth. And please don't give them water, because their swallowing reflexes have not yet recovered and is highly uncoordinated. Now, this could go down the wrong way and give rise to respiratory infections, right? And of course, the last statement are also very important, because they've just come around from a massive impact of neuronal impulse on their brains. So to expect them to give you, Mensa level answers when they're recovering is very difficult. So just let them be. They all eventually recover most of the time. So, yeah, now let's go on to a stroke. Again, for some reason, all these terms seem to have violent beginnings. So a stroke was actually named so because the ancients believed that it was related to an act of violence, being struck by spirits, lightning, a blow to the head. All of these were the origins of this term. So there are two terminologies. One is I'll get into both. One you need to know is called an ischemic stroke, and another called hemorrhagic stroke, both of which I'll talk about a little more. So now when blood does not flow to a certain part of the brain, that results in those nerves around the area where that blood is supposed to have gone to dying, and that's what you call as an ischemic stroke. So these strokes are also called cerebrovascular accident, and to bring a sense of urgency to responding to strokes, the word brain attack was popularized since the late 90s. Now, this is an acronym we must all remember if you suspect a stroke. It's FAST. So FAST stands for a droopy face, the arm going weak, speaking difficulty. So if you see any of those three, T is time, transport, whatever you want to act now, right? The reason for this is unlike what was believed. Over 80% of these patients can recover if they are attended to promptly. These are some other, unusual stroke symptoms. They could have fluctuating vision, sudden behavioral, brief changes which recover completely, like agitation, talking about or hallucinations. These are also indicative of brain dysfunction. Could be stroke, could be seizure. A seizure could also be indicative of a stroke, and they could have nausea and difficulty with walking. So this is another kind of stroke we call as a hemorrhagic stroke. Now, in this, the cause of stroke is kind of different. As you see, an abnormal blood vessel could give way and blood spills out into the brain under much higher pressure than the brain is usually used to. Now, this kind of stroke is often seen with hypertension. Sometimes even children who have abnormal brain arteries could get this sort of stroke. Now, stroke first aid, there is very little that can be achieved at home except for comfort. So make them sit or lie down, just make sure they don't hurt themselves and ensure that they're breathing. The first step should be to call them an ambulance and get them to the hospital within that first hour of when you notice symptoms, because that's really the golden hour for recovery. Coming to falls now. So again, this theme of see Dr. ABC is something that I can't emphasize enough. So if there's just one thing to take away from today, it's this acronym to see Dr. ABC, right? So always look around you, because when somebody's fallen, the presumption is that they've fallen in an area where there's possibly a dangerous predisposition. And falls needs to be kind of looked at from all age groups, from pediatric to geriatric, and the kind of outlook for all could have some overlap. So now if you see them fallen and they're not breathing, obviously go ahead with CPR. In modern times, the mouth-to-mouth may not be needed. Even if you do chest compressions, it's good. Make sure they don't have any constrictive clothing. So let them lie in place, ensure they're breathing. Do your primary survey from head to toe to look for any bleeding or deformity which could indicate, fracture, sprain, muscle tear. Now, if you do see evidence of bleeding, the first thing to do is wear gloves and just apply pressure, no matter where it's from. And always look for any signs of head or eye injury, because these could also give some clues to, the hospital staff when you hand over. So active bleeding from nose and gums, often just a minute's pressure would sort it out. For sprains, this acronym called RICE is something that you should try out at home. So just rest the injured part, ice it 20 minutes at a time, compress, of course, no tight crepe bandage. This is something that you have to get over. Just gentle compression is fine, and elevate it about a foot above the heart. So look for color change, swelling, deformity, because like I told you, this could denote fracture and a rupture in some other of the soft tissue. When they're conscious, they would find their own best comfort position. So probably, even if it's a fracture, telling them to support their own limb, minimize movement would give them a lot of relief. And simple paracetamol, 650, 1 gram is fine with respect to painkiller if you have it. So here's the don'ts with falls. Never move them unless you need to do so from a toxic environment, for example, a gas leak in the kitchen or something like that. Because when you're not sure on the extent of damage, you could actually worsen them if they have something called as an unstable fracture in the spine. And it's not uncommon that well-intended movement has resulted in paralyzing people for life. So never move them, make them sit, stand, wait, bear, unless you're certain that they don't have severe backache and things like that. And the last point is to not remove any objects that are stuck in the wound, because these could be kind of tamponating on a blood vessel, and sometimes you kind of unmask a silent bleeder by removing it. So preventing falls, well, a lot of this is common sense, but I think this needs deliberation as well at home. Clearing clutter, making sure all your walkways have adequate lighting. And this third point is extremely applicable in the elderly. Anyone who's had a fall in the past probably has the highest correlation for having subsequent falls. So if somebody has already had a fall at some point in their life, it needs extra precaution, because these are the predispositions for repetitive falls. Now, physiotherapy by strength and gait training is always great, and I can't emphasize that when you look at the number of children and the falls related injuries they've had. So I've seen kids who fall off the grandparents' arms while being carried in the balcony from various floors, some lucky, some not so lucky. So please be conscious of the environment you're in when carrying your kids. Okay, so now let's shift over to fainting, a not uncommon symptom. Interestingly, this is actually the brain's response to reduced oxygen or blood supply, and is actually a protective mechanism, and which is a temporary brain stroke in that sense, from which you always recover. So it's got numerous causes, and as I'm sure all of you know, excessive neural emotional stimulation from pain, fatigue, and extremes of emotion could be responsible for fainting. So some of the symptoms before fainting are your legs give way, you're lightheaded, you could have blurred vision, swimming objects in front of you, and you could feel nauseous. Now, with fainting, first aid is kind of simple. You make sure they're breathing, very important. Always the C Dr. ABC comes first. Lay them down. Make sure you lift their legs. Now, lifting the legs kind of improves blood supply back to the brain, and helps in a quick restoration of, like I told you, the oxygen and blood supply to the brain. Loosen constrictive clothing, like belts, if the shirt buttons are tight, whatever, make sure you loosen it. And of course, breathing. Now, here are some things that recurrent fainting could, be hiding. Some people with cardiac disease could have these recurrent fainting episodes. Seizures, tumors in the brain could have fainting episodes. So it's not always, a very benign condition. So please keep this in mind when you see someone who comes, with recurrent fainting episodes. So, yeah, let's kind of see our key points from all of this. So with seizures, you need to know, protect the injured, turn them over, observe and time seizures. They all are self-limited and will pass most of the time. This is more than enough as far as first aid in seizures goes. With stroke, the acronym FAST is the most important thing to remember. You make them sit, lie down, and call the ambulance. With falls, check the airway, breathing, circulation. Don't move them. Just apply gentle pressure to the bleeding point for about a minute or so, and all these bleeding should stop. I mean, if somebody's on a blood thinner, it may require applying pressure for a little longer, but pressure is the most important thing. With fainting, lift their legs, check airway, breathing, circulation. Very important. Now, just like you wouldn't hesitate to take a new road to get to a known destination or a road to a new destination, I'd like to emphasize you're never too old to learn something new. So first aid is something we can all begin with learning. So in conclusion, anyone, anytime, any place can have an emergency. Let's all be prepared. Keep rehearsing basic first aid. Now this third point, act appropriately. I mean, in medicine, we're always taught to first do no harm. I would say this is equally important in first aid as well. So at this point, I remember 10 years ago, I had a 30-odd-year-old mother with a 6-year-old daughter who collapsed at home, had a stroke. This young girl was trying to call her father's phone, couldn't get through. Now she managed to contact the hospital, got an ambulance. This mother had a hemorrhagic stroke from what we call an aneurysm. She underwent surgery the same day, and now 10 years later, they are all healthy and doing well. And I found it just amazing that a 6-year-old girl at that time had the presence of mind and called for an ambulance straight away in spite of not reaching out to her. So store hospital and ambulance contact numbers always. And above all, make sure you remember these 2 P's. Get your kit ready and participate often in these first aid programs, because honestly, repetition is something that always strengthens your familiarity with a new skill. So even countries like Norway, where they say over 90% of the population is familiar with first aid, when it comes to actually performing it, that percentage drops to about 50-60%. So it's necessary to reinforce this as with any new skill. Before I conclude, I'd like to acknowledge the phenomenal effort of our frontline workers over this pandemic over the last year. This was the most popular name of last year. I'm going to take questions now. Thank you.
Thanks for the very, very concise and very, very informative talk. You couldn't have summed it up better. A few things
Thank you.
I would like to add from personal experience. As far as seizures are concerned, there is a particular nasal spray that is available called midazolam nasal spray. It's called Midacid. So people who have had, especially children who have had a common condition called febrile seizures. Some children get seizures when they get high fever. It's a very frightening kind of situation, but it's basically harmless. All they need is, for the temperature to be brought down. In such a situation, there is a nasal spray available which all people can keep at home. And the moment the child develops a seizure, you can give them a spray into each nostril. So that till the time you reach hospital, you don't have to have the child convulsing continuously. The nasal spray brings down the convulsion. About stroke, like Neil said, I don't think there's anything much you can do except, make sure they're breathing and get them to a hospital as early as possible. Regarding falls, few things which people who are old can follow is number one, declutter. Like Neil said, declutter the house. You don't need so many things, especially when you're old and you're likely to trip over them. Second thing, do not use chairs with wheels if possible. If you have to get up or get off them, take help. Number three, don't think that you can help a person who's right on the ground when you are old. Call for help. Don't try to help somebody when you don't have the strength. Regarding fainting, yes, what Neil has told is absolutely right. We see it very commonly in the clinic, especially in adolescent girls after injections. All you have to do is just lift their leg up so that the pooled blood, pooled in the leg, will suddenly be returned back to the brain and they regain consciousness. Thank you.
Another question we have is, What's the difference between a stroke, a seizure, and a heart attack?
Stroke, like I told you, you have to look out for fast, which means look for face drooping, arm weakness, speaking difficulty, right? So these are the most common symptoms in a stroke. With a seizure, you would see jerking or chaotic movements. So it's not very similar. One is probably absence of movement, while the other has excessive movement. So that's what you should look for with distinguishing between seizures and stroke.
Can I add something? I'm Dr.
Please,
Satish.
please.
Yeah. So last time I told about the golden hour period as far as heart attack is concerned. See, now both the heart muscle and the brain tissue are the most sensitive oxygen requiring tissues in the entire body. So, like I said, the golden hour or hours in terms of heart muscle is up to 6 hours. But in case of brain tissue, this golden hour has been brought down to 3 or 4 hours, right, Dr. Bopanna?
It is when you do thrombectomy, it has to be done in the first hour ideally. Up to 3 hours is
So the time frame is even less in case of brain tissue because brain is even more sensitive than the heart muscle. So again, to reiterate, just like I said, heart attack, and Dr. Neil said it's a brain attack. In brain attack, you have even less time. So it's very important to get the patient to the hospital as soon as, I remember last time I had said time is muscle. I don't know what they say. Time is brain tissue. Even more important in cases of stroke. So anybody who has an unexpected loss of consciousness or, like you said, a lack of movement on one side or sudden altered behavior has to be got to the hospital as soon as possible. So all the other things which we are told about being prepared with ambulance numbers and all these things are very important. And also one more point, if I may add, like what you said, I think that's an extremely common practice here in cases of any fainting or head injuries or any unconscious patient. The first thing people do is make them drink water. And that is about the worst thing that you can do. Because in an unconscious patient, and like I said, I think I said this last time, you should not, in case of hypoglycemia, you should not force feed them when they are unconscious. Because like doctor said, the swallowing reflex is not present. So invariably, if you try to force liquids down their throat, it is going to go into the lungs and cause aspiration pneumonia or some other infections. Thank you, Dr. Bopanna, for a nice talk.
Yeah, thanks. No, that's a good point. Absolutely, I agree totally.
The next question is, could you explain a bit about applying pressure to an open wound?
Yeah, so when you have an open wound which is actively oozing, most often, unless a major artery is ruptured, it would be from what you call as capillaries being disrupted in the vicinity. Now, these are all low pressure bleeders for which you need to, initiate the clotting cascade because corollary in medicine is most bleeders will eventually stop. So to promote clotting, you need to slow the turbulence with which blood is flowing through these arteries. So by just applying moderate pressure, I mean this moderate I understand can be subjective, but anyway, the as long as you don't see active bleeding with the pressure that you apply, wear on gloves so that it's sterile, have sterile gauze or cotton pads, whatever you can do. Just apply pressure on it for a minute to initiate the clotting cascade.
The next questions we have are not pertaining to any of the topics, so any of the doctors wanting to answer could answer. So the first question we have is, could you please explain how to react to a snake bite?
Yes, snake bites are could be The snake could be non-poisonous or poisonous or venomous snake. So what we have to do, first and foremost, is do not panic, which is the first reaction of every patient who is bitten by a snake. You must try to identify the snake, but the most important thing is, to try and open the wound if possible, and let it bleed a bit. Do not try to, and we can apply a tourniquet if it's around if it's bitten on the limb, as it usually is. You can apply a tourniquet so that the blood doesn't go to the heart. And of course, you have to rush them to the hospital, because if it's a venomous snake bite, then they will start showing the symptoms within a few minutes. So they have to get that anti-snake venom, as polyvalent anti-snake venom, as soon as possible in whichever hospital it is available.
What I can add is the traditional teaching of suck out the venom from the wound by biting into it and sucking into it is absolutely a no-no. You cannot do that. You just have to tie a tourniquet so that the blood supply to that area, the venous drainage from that area is reduced, and shift the patient to the hospital as early as possible. Another thing you can do is, if you have somebody, or if you can, take a snap of the snake, because that will give valuable information to the doctor as to whether it's venomous or non-venomous. So we can take a picture of the snake, take it, and then proceed to the hospital as early as possible.
The last question we have is there any difference between syncope and fainting?
No, both are the same thing, I think, Dr. Bopanna.
Yeah, absolutely. Both are the same thing. Syncope is the medical term for fainting.
I don't think we have any more questions. So we just wanted to thank you, Dr. Bopanna, for your time and for all the valuable information you've given us. And I'm sure all of us have learned a lot. And it was a very good presentation. Thank you.
Thanks for having me.